So once again, thank you, Julie, for doing these presentations. And for those of you who don't know me, I'm Troy, chair the Queensland New South Wales branch, and also sit on the national board. We had our awards night in Brisbane on Friday night, and Julie was our guest at the awards night. So we had a really good night, and there's some committee members online here I see, and some of those people won awards. So congratulations to the Marta and to everybody else who won an award, the Royal Brisbane Women's Hospital, and there were some people from 2 individuals from Majestic Services Aged Care. So they all did really good jobs and won awards, so it was good. Well, perhaps what we might do, if you're ready, Julie, we might start, and then it's recorded anyway, so people can watch the beginning of the recording, or they can catch up if they dial in later on, I think.
Okay, that sounds good.
Thank you.
My pleasure. Thank you again for the opportunity. So what I'm going to do first up is just mute everyone because it helps with our recording. Okay. All right, so this is our 5th webinar, and we're looking again at the fork pressure test and some particle size information, but particularly with a spotlight on IDDSI level 6, the soft and bite-sized. And I'd like to again thank Troy and the IHHC for their partnership with the Australian IDDSI Steering Committee for this webinar, and also thank our international and national sponsors. So when we have a look at the foods and we start to compare the Australian national descriptors with IDDSI, we're focusing particularly on the soft and bite size, so level 6. This is an example of one of the cards that we've developed. The templates of those are available on the IDDSI website under the resources section if you wanted to print any of those as a ready reference. And this is what you'd be quite familiar with our Australian standards, and so we're looking particularly at this one here, which is the Texture A Soft. And I'm going to go through that in a little bit of detail because over the 11 years that we've had the Australian standards, there have in fact been some misinterpretations of that. So again, just having a look at why the terminology and the definitions are so important. And when we talk about what is soft, when I say something is soft, we want some objective measures for people to be able to say that, yes, in fact, that also matches their definition of what soft is. So sadly, we have information that comes from the New South Wales Ombudsman's report into the deaths of people with disability in residential aged care. And there's a particular comment down the bottom here. So the death of a boarding house resident from choking on a sandwich after being discharged from hospital on a soft diet without any guidance for the person or the boarding house staff on what that meant. We have another one that we saw at our last webinar as well, again, a particular case study. What I particularly wanted to draw attention to here is that it sometimes is not just the person's chewing and swallowing ability, but also other factors that increase choking risk that clinicians also need to be mindful of when they come to choose the most appropriate diet. So in this particular case where the gentleman had chronic swallowing problems, few teeth, and we'll talk more about that later on, eating quickly and without chewing, overfilling his mouth, and taking food not prepared for him. Also, some information that you may not be aware of. So when we look at choking deaths by age, I think we're all really familiar that young children have a very high choking risk. But in fact, as this graph shows, as we get older, and particularly over the age of 65, the risk of choking is actually 7 times higher in this part of the population than it is for children aged 1 to 4. So again, we looked at these last webinar, but I thought it was worth reviewing. So what does normal chewing look like? So this is a video fluoroscopy. We're looking side on it with someone with normal chewing ability. The food gets chewed and pushed down. And then you'll see the tongue move around and swallow any residue down as well. So we've got the ability to check and make sure that there's no residue on the teeth or in the gums as well. And you can see that the mouth is nice and clean afterwards also. A very quick process, and went down without any residue. When people have a chewing problem though, so in this first one that we're going to watch, you'll notice that the person, when they open and close their jaw, that it's quite limited, only little movements, and the food is all the way at the front of the mouth. Now this person may not have any molars at the back. We can also see food falling over the back of the tongue. This is the airway here. We don't want that food to fall into the open airway. So that's where the danger comes in. Then we've also got other people who may not chew the food at all. And if you watch this black piece here, for this particular person, they don't chew it. They have difficulty using their tongue, and to move it to the back of the mouth to swallow, they tip their head back. So let's have a look and see what happens here. The head goes back. That solid piece has gone down into the throat and down towards the airway. So that's what a choking risk looks like. This is what we are trying to avoid. So I wanted to start by clarifying a little bit of confusion around the current Australian Texture A soft diet. So as you know, our Australian standards were published in 2007, and there was testing information that was included on each of the different levels, and this relates to the Texture A soft, so on page S66. So particle size was actually always included in the Australian standards. The targeted particle size for infants and children was less than that, less than half of that for adults, or equal to 0.8 centimetres, and the targeted particle size for adults was 1.5 by 1.5 centimetres. The second thing that I want to draw your attention to, on the page beside that, there were a list of foods that were appropriate and foods to avoid. There were little superscript letters next to various food items, so things like the soft sandwiches, the pasta, the well-cooked vegetables, soft cheese and egg. And that was that it requires case-by-case consideration. So those items were never actually intended to be part of the standard soft menu. So this is, again, this is a screenshot from the actual article that shows where your targeted, your testing information is. Yes, there's some descriptive information here, but there is in fact testing information. And then on this page where you've got the foods that are soft, if I can make those a little bit larger, I will. So we can see here that the foods have got a little asterisk there where it was always intended that they needed case-by-case consideration. I mention that because there have been some changes recently. So I know, for example, in Western Australia that sandwiches have in fact been removed from the soft diet in Western Australian health facilities because of some sentinel events that have occurred there, i.e. deaths by choking, both in rural and remote and metropolitan areas. So the IDDSI framework is, as far as we look at here for particle size, what are we trying to achieve? What's our physiologic rationale for this, this food texture? So for our soft and bite size, we're looking to replicate a bite of food. So this is for people who might have difficulty potentially with cutting, but particularly with chewing the food down to or taking a bite of food into the mouth that's the appropriate size for them. So we want it to be a bite of food or food cut to enable comfortable chewing and oral manipulation, and that is 15 millimetres by 15 millimetres, or roughly the size of your thumbnail for most people. So, or 1.5 by 1.5 centimetres. And for infants, the 8 by 8. So you can see here immediately there is in fact no difference between the IDDSI soft and bite size and what is currently in the Australian standards. From a physiologic point of view, we know that chewing is necessary. You need good tongue control and strength to be able to move that food so that you're going to place it between the teeth for chewing. And you should be able to easily cut this texture with just the side of a fork. We do, however, have more. That's not the only testing requirement there. So we take a piece of bite-sized food that's about the size of your thumbnail, then you push using the fork into the food. A metal fork obviously is going to be easiest, and the food should squash easily and not return to its original shape. So we have some information here as well about why we choose to do that. So the pressure that you apply when the thumbnail blanches to white is about 17 kilopascals, and that is the same strength that's used for between 17 and 20 that the tongue pushes back for swallowing. So I've got a couple of videos here to show you. So this is the fork pressure test. The first demonstration is where it does not pass, and the second one is where it does pass. So this is some broccoli. You can see that that broccoli has been completely deformed there. Not just squashed flat, but completely, the structure of it has been destroyed. This is a piece of meat this time. So we don't just want to squash it flat and leave some fork marks in it. We want to be able to completely pull it apart. We've got one here where the food, the vegetables have been cut to the appropriate size, but they don't pass the fork pressure test. So it slips out first of all, and you can see that the wrist is now being rotated to try and break that piece. So that's not appropriate. That's way more pressure than just using the thumbnail blanching to white. And you can see that all we've done really is push it through the fork tines without destroying it. I wanted to also show you, so this is a meal that could be appropriate for a level 6. You'll notice that not everything is diced to exactly 1.5 by 1.5. You can have things smaller than that so that it looks like something you might want to eat. So we've got some carrot in there, we've got some meat in there as well. These pieces are probably a little bit too large, and the skin on those would not be appropriate, but the demonstration there is more around the fact that you can have some variability in the particle size, but nothing larger than 1.5. One of the questions that I'm often asked is, why aren't sandwiches on the level 6 soft and bite-sized diet? And there are a few reasons for this, which I'm sure you'll all understand as we talk about it. So bread types, not all breads are equal. So when you consider, some nice soft white bread, what we would consider nice soft freshly baked bread, some white bread that might have sat in a packet for a couple of days, some brown bread, multigrain bread, baguette, the very crusty sort, bread rolls, brioche bread, gluten-free bread. We call them all the same name, but they are in fact all quite different. If you were to dig down into some of the technical side of that, you'd be looking at the size of the crumbs and also the moisture content. Now that moisture content comes from the bread itself, and also when we come to chew and swallow it, we need to add saliva to it. For some of our elderly patients in particular, or for anyone who's on a lot of medications where their mouth is quite dried out, that part of it, moistening the bread, can become quite problematic as well. In addition to all of that, we've got fibres that need to be broken down. If you think about bread and trying to use that fork pressure test with it, you'll squash it flat, but you won't destroy it using the fork pressure test. And then you also need to consider whatever filling might be on the bread as well. We come back also to autopsy data. So people have died from choking on various types of food. And what I've done here is gone through these various publications, and I've highlighted in particular the bread and the meat and toast. Bread, meat, sandwiches, meat, bread, meat, meat, sandwiches, bread, meat, sandwiches, steak. They come up consistently. So there's a reason why we don't include bread as standard. We don't include it on the soft and bite-sized diet at all. The next question that I get asked about with the soft and bite-sized is around dental issues. So perhaps people have previously been using that Texture A soft diet for people who might choose to have softer food, with the idea and what's commonly referred to as a dental soft diet, for example. So I need to share some information with you about dental issues. So there is a high correlation between missing teeth, ill-fitting dentures, dental disease, and sudden choking deaths. So that's important to understand. People who've got dentures have only about 25% of the chewing effectiveness of people who have their own teeth. And they tend to produce boluses that are much larger and particles that are much larger. And that's what it is that increases their choking risk. If you also think about a full upper denture, you've got something covering the top of your mouth where all of the receptors are that would be able to feel that food to let you know that it needs more chewing. So that's one of the other reasons why dentures can be problematic there. They're covering surfaces of the mouth that we would ordinarily use to help us work out whether the food has been chewed sufficiently. The other thing is that where there are dental issues as well as behavioural issues, so things like mouth stuffing or self-regulation issues, so taking food intended for someone else or not chewing the food particularly well, all of those things increase the choking risk. So it's not as simple as saying, oh, well, they just need softer food if they've got dentures. There are, in fact, a number of other factors that need to be considered, which is why we always intended for people to have a clinical assessment. If we look at dental bite force and choking risk, again, just some information. When you've got 20 teeth and 10 of those units that will match up so that you can bite the food effectively, the bite force on that is 555 newtons. As we reduce the number of teeth we have, you can see that the bite force reduces. By the time you've only got between 1 and 9 teeth left, you can see that you've got less than half the bite force of when you have 20 teeth. When you have no teeth, you only have 155 newtons. So there's some other information there as well. So at a minimum, you need 4 symmetrical, 4 teeth that actually match up and 6 where they might not match up. That gives you your 10 units. And we have data that also shows that if you've got fewer than 13 teeth, you increase by twice as much the risk of dysphagia. So I recognise that this is a tough balancing act. I recognise that, you know, with this soft and bite-sized diet as well, we're trying to, and all texture modified food, in fact, we're trying to match up food that looks appealing, that gives people variety and visual appeal with something that's safe, where we recognise that there's often reduced choice, a lower choking risk, and quite often visually unappealing. So we're working really closely with chefs on that. That's one of the really exciting parts of this initiative, and certainly something that 11 years ago, when we launched the Australian standards, where we came at it from a very profession side of things, rather than looking especially to collaborate with people from food service and cooks and chefs. So that's quite exciting. In terms of changing from our pediatric to adult particle sizes, again, our information on those particle sizes comes from the diameter of the trachea. So we're trying to make sure that the food sizes are small enough that they pass through rather than blocking the airway there. So how do we know when it is you might change from a pediatric to an adult particle size? It's when they are physically big enough. And in that regard, it's similar to thinking about the weight of a child, for example, when you change their car seat orientation. It's not based on their chronological age. If you did need some further information about when the size might have changed, puberty is a very rough guide. And again, you can even see on the slide there that there's a wide range of normal. So for girls between 10 and 14 years, for boys between 12 and 16 years. My other recommendation, though, would be to speak with the child's doctor. If they are happy that there's been sufficient tracheal growth for them to move across to the adult particle size to minimise choking risk, then that's perfectly fine. Just some information also about level 7 regular and a subsection of level 7 that you'll be hearing more about from IDDSI as well. So our level 7 regular, we've got these people who are placed on a 7 regular diet do not have increased risk of choking other than you or I, for example. So there are no particle size restrictions. It includes all textures, so soft textures, hard, chewy, crunchy, all of those things. We know that chewing is necessary. We know that tongue strength and control and the need to move the food for chewing and swallowing is necessary. We did hear very strongly at IDDSI International that the people needed an opportunity or a way to account for people who in their own homes, for example, might choose to have softer foods, but not necessarily bite-sized. So name for that. So after we had a stakeholder survey out that was open for over a month, and we had more than 2,000 responses from about 50 countries around the world. And the name that was most popular for that was Level 7 Regular, Easy to Chew. So this is essentially soft food without the particle size restriction. The key features here, though, are that there is no increased risk of choking and no mealtime behaviours that increase that risk. IDDSI will be providing further details about that level and also about how you test for it as well. I mentioned earlier on the little business card, double-sided business cards that are useful for ready reference. And the templates for those can be downloaded from the IDDSI website under the resources section. There's one there for the flow test and also for the food testing as well. So the little markings down the bottom have been designed by our graphic artists to be the correct sizes for you so that you don't need to find a ruler, for example. I also wanted to let you know that we've got on the IDDSI YouTube channel, we've got a number of webinars recorded there. Last week there was a webinar by Preston Walker and James Ball, who are chefs from Oak House Kitchen, and they spoke specifically about preparing texture modified food. It was an absolutely fantastic webinar. They provided really useful information about even the cuts of meat that you choose, cooking methods. There were some recipes that were shared as well. So if you didn't have an opportunity to join that webinar, it will soon be up on the IDDSI YouTube channel and is definitely worth watching. I'm going to switch, and we can certainly do questions about food at the end, but over the last month, there have been some questions that have come up from people who've been doing some testing, which is fantastic. So just answering some questions about the IDDSI liquid testing. So just a very quick reminder about the flow test, making sure that you've got the correct syringe for that. So it needs to measure 61.5 millimetres from the 0 to the 10 mil line. And then the information is there that you put 10 millilitres into the syringe, release the nozzle, time it for 10 seconds, and then stop after that. So slightly thick, mildly thick, and moderately thick, your very first thing that you do is measure using the flow test. Where there seems to be some, and sorry, just to go back on those as well, the only method for testing slightly thick and mildly thick is to use the flow test. There are no fork tests for slightly thick or mildly thick. If you are finding a discrepancy, so if you're finding something, so if for example, I know that if I go back here to slightly thick, with buttermilk, for example, it will test at slightly thick on a couple of provisos. So it needs to be thoroughly incorporated. If you've got any separation of that buttermilk, you'll find that a portion of it will run fast and then a portion of it will run slowly. And what that's telling you is that the liquid inside the syringe is not in fact homogeneous. You have in fact got thinner and thicker liquids within the one syringe there. So you may find that, for example, I've had a similar situation in trying to thicken beer where the liquid portion of that remained thin and the foam portion thickened. So what you have there is in fact a mixed consistency, and you'd need a clinician to work out whether or not it was safe for the person to have that, or you find a way to bring it all back so that it is a single thickness level. So if after testing you're moderately thick, if you only have 1 or 2 drips or you have 10 mils left, it's important then to work out whether in fact you do have moderately thick or whether you have a pureed or extremely thick consistency. And that's where the fork test comes in. So our moderately thick, you can see here that there will be just a tiny amount over the top of the fork, but it will be dripping through in thick dollops or strands through the tines of a fork. We're working on some videos to help provide you with some information about how quickly they might flow or what that exactly looks like, because we believe that videos might be, again, just provide an extra piece of information for you to assist with that process. With the extremely thick, you'll notice that there is a mound above the fork and just a small tail below. The other thing to point out here is that you could eat pureed or extremely thick with a fork. You wouldn't be able to do that with liquidized or moderately thick liquids. So the process for testing a liquidized or moderately thick is first of all the flow test, and then you move across to the fork drip test. We also have on the IDDSI website, we've got audit tools there, and you'll notice that the audit tools for the drinks, you can see here that we've got the flow test information for thin, slightly thick, mildly thick and moderately thick. You can see that the fork drip test is only for moderately thick as well. Some other questions that have come up. So does testing temperature for our liquids matter? It also matters for food actually as well. So yes, it does. So test the liquid at the intended serving temperature, or whatever your manufacturer has advised as their intended serving temperature. Now, thick liquids have actually always varied according to temperature. It's just that you now have a tool that shows you this. In terms of foods and temperature testing, again, when you've got something that's nice and warm, it's going to be much easier to push a fork through that. If you've got food that's sat and cooled off for a while, it might end up with a skin over the top of it, and it may also become more firm. So that's why I say that temperature is quite important there. One of the other questions we've had, how do we measure the thickness of nutritional supplements or drinks with natural fibre? So if you've made your own smoothies, for example. So starting off the answer to that question, many of the nutritional supplements could be classified as complex fluids. So these often take a bit longer to thicken, or they don't thicken particularly well. They often have tiny, gritty, grainy particles. And when you put those, they're swimming about within the liquid portion, for example, and you put them into the syringe, you can end up with those gritty, grainy particles sort of coming together at the nozzle and causing a bit of a traffic jam there, which will slow the flow and perhaps give you the impression that it's a thicker liquid than it actually is, because when you look at it, you might say, well, actually that's quite a thin liquid. Why is it coming out to look as though it's a thicker liquid? And it's because there's something that's coming together and blocking the nozzle there. If when you put that sample into your mouth, you can feel those gritty, grainy bits, then again, you need to talk to your clinicians to work out whether that's actually safe for someone with swallowing difficulties. On that particular topic as well, the rheometers are also not able to cope with those gritty, grainy bits or incompletely mixed liquids as well. In terms of the smoothies that you might make yourself, then sieving is probably what's most important there to get rid of the fibres, and then you should be fine. Why do drinks of the same thickness but different flavours test as different thickness levels? And there's actually a couple of different reasons for this. So sometimes you could have interactions between the thickening agent and the protein. So milk-based thickened drinks versus water-based thickened drinks. You can't just add the same number of scoops of or the amount of thickening agent, for example. The other thing is that if you're making a milk drink, for example, and you've added some caramel topping or some chocolate topping to it, those toppings often already have thickening agents in them. If you go and look at the codes on them, you'll see that they're there. And so then if you add another thickening agent to that, you'll find that there are some interactions there. We've already discussed temperature as well. So just being careful to make sure that if you're noticing a difference in the same, it might be a banana flavour and a chocolate flavour, for example, just make sure that you're testing them at the same temperature. As well, you might find that one of them comes into range at cold or at room temperature. So looking to see what the intention is there. And it might also be, so if it's a pre-thickened drink, it could be that the testing methods that have been used are either not as sensitive as the flow test, or in fact that they're just measuring different information about the liquid. So that's why that variability could be there. So as Troy said, this is the events page on the IHHC website. I just wanted to show you where the videos are also being recorded onto the IDDSI website. So our IDDSI YouTube channel, we can see that they're up there as well. The other thing I wanted to let you know also, I know that we're lucky enough to have people in our kitchens who may speak a language other than English. And if you're looking for information about IDDSI, we do have IDDSI translations that you may find helpful. So we've got some completed translations in Farsi, French Canadian, French, Italian, Norwegian, Portuguese, from Brazil and Swahili. I know these might sound, you might think, why have we got such an unusual group of languages up there? We are very lucky to have volunteers who contact us to say that they'd like to translate. We also have a number of others that are currently available for review on the website. So Arabic, Simplified Chinese, German, Greek, Russian, Spanish and Vietnamese. And then we have a number that are in progress. So the Japanese, Thai, Turkish, Dutch, Hebrew, Urdu, Zulu, Slovenian, Chinese Hong Kong, Chinese Taiwanese and Marathi. Just a reminder again that you can download the free IDDSI app for both the iOS and Android platforms. One of the things that IDDSI is working on is a poster. We've also got patient handouts that will be available very soon for you as well, and also videos, as I've mentioned also. So in all of this, what we're trying to do is to keep people safe. We're trying to make sure that we don't end up with choking risks. When I recognise that it may be challenging sometimes to look for alternatives, particularly when it might be very easy to go with a packet of sandwiches, for example, but just remembering that there's a reason why we're doing this, and that if it were us who ended up in an emergency department or a transfer ward, or if it was a parent or a grandparent, we would want to make sure that those people are safe. So just a reminder that it's people who we're doing this for, to keep them safe. I'm about to open up for questions, but if you should think of something afterwards, or if you'd like to join the mailing list, it's easiest to contact me at australia@iddsi.org.
So thank you so much, Julie. That was very good. I know there were a couple of questions that were emailed to me, and I'm pretty certain that in Julie's response just a moment ago, she answered those questions. If not, there's time now if people want to use the chat box to type a question in, or just unmute yourself if you do have a question. Anybody having any challenges in their workplace with trying to pass on comments to people about IDDSI and even starting an implementation plan? So I've got a question that's come up here while you're thinking about that as well. And the question was, how do you serve a dessert, desserts such as a baked custard, as a soft and bite-sized level? So with those, I'm thinking, and this is where it's challenging, I guess. If we had the thing in front of us, it's sort of easier to look at. If it's something that you can, if it's more like a mousse, I guess, then that's more like a level 4, because it doesn't have those particle sizes. So that is something that someone can scoop up with a spoon. You don't need to kind of chop it, if you like, if that makes sense. If there are particle sizes in it, then those need to be at the 1.5 there. As I say, with something like that, it's probably easier to look at look at the actual item and to run it through the different testing methods to work out what it is you've got. We've got another one there. Will there be an education or quick reference for nursing to assist with the difference now to soft? For example, they will order a soft sandwich, and I see this will be challenging, yeah. Yes, look, we could certainly look at perhaps like a poster or an education campaign to help people understand that, as something that, as I say, was never intended to be on there, but just through happenstance made its way onto the sandwiches made their way on there. I'm thinking, apart from for nursing, potentially also emergency and ambulance as well. I know there was a sentinel event in Canberra of a patient who was transferred from a hospital back to their aged care facility, who was on a pureed diet,
and they were hungry en route, and the ambulance officers gave them a sandwich and the person died.
Is that something that individual organisations would be looking at, Julie, or is it something that IDDSI would consider?
Yes, so certainly the Australian IDDSI Steering Committee, this is, I would say we could probably add this to our risk register as something that we recognise could be a problem, because people are used to seeing the sandwiches on an Australian soft diet. So I think that's a really valid thing, and I'm sure that that's something that the committee would be very happy to support some education pieces around that. So whether it's a poster or a screensaver or something like that.
Yeah. Okay. Cool. So, given this is our last webinar, is there anything moving forward into the new year? Are there any topics or anything from the webinars that we've held so far that you would like assistance or direction from Julie or from myself or from the IHHC, or is there any opportunity for us to do a couple of webinars next year to help you put together perhaps an implementation plan or some examples of implementation plans for implementing IDDSI come 1st of May next year?
So we've got a question here. Is there any update from industry on product? What our industry have asked for you to do as consumers is to contact them directly. So you can appreciate that that they're keen to answer questions about their own products and what their plans are for implementation dates. Do you have more information on the IDDSI labelling requirement due by May 1, 2019. So we do have just generically a number of industry who have indicated they will have product labelling. It may even be ready slightly earlier than that. You may even start to see it in April, for example. So as per the current Australian labelling, it's not mandated at all. So it's from a safety point of view that we have that there. And then I've got another question here, just confirming sandwiches are off the menu on a soft and bite-sized menu unless specified as suitable from the speechie. The only hassle with it, they would need to be cut to the 1.5. They're not going to pass, I think you'll find, a standard sandwich. What I can share with you, and we talked about this last time actually, was a different way of preparing sandwiches. So that's where you take the bread and you use a food processor to break it down into fresh breadcrumbs. So you can't use store-bought breadcrumbs, but you can take fresh bread and break it down into, use a food processor to blitz it down into breadcrumbs. You can put it into a square mold, spray the liquid with using an atomizer type thing with something like water or milk or stock to give it a little bit of moisture. Then you can put an appropriate filling over the top and then more breadcrumbs over the top, and again lightly spray it. You can put that in the fridge. When that comes out, you can cut it and divide it. You can't pick it up in your fingers, but you can certainly eat it with a fork or a spoon, and it actually still tastes like a sandwich. So that's the way you would get around that. In terms of the sandwiches, the kind of concept that might be there potentially under the easy to chew, that's where you would be looking at. So the level 7 regular, where we're talking about no increased choking risk. I guess that's the thing that I'm trying to indicate, that bread and sandwiches are a choking risk. That's why they're not on level 6. That's why they are in level 7. Then another one here, perhaps a prompt sheet or a checklist working through the main changes and areas that might require specific information, clinical elements to be emphasised. So I like the idea of a prompt sheet or a checklist. The other thing that I've said as well, we've talked in the past about the green label change. And so where that comes in as well is looking, so it moves from the mildly thick to the extremely thick. So I'm asking clinicians to think about, would there be a problem if you had a patient whose on mildly thick liquids and they accidentally received extremely thick liquids during the changeover period, is there a clinical risk, and how will you manage that clinical risk? We've got another question here. Can I expand on regular easy to chew versus regular, what the differences are? Yeah, absolutely. So we're trying to include, where we're in the process, the IDDSI board is in the process of putting together the fact sheet, and we'll have the updated framework to show all of that information on there. So the regular diet includes every kind of texture you can imagine. It includes hard, chewy, stringy, spiky, soft, pureed. It includes absolutely everything. The regular easy to chew does not include hard items. It doesn't include tough or fibrous items. It doesn't include bones. As I say, there are testing methods. It's to get around the, so we had people say, look, people will have pancakes or omelettes or fish, for example. How do we provide them those where they don't need to be chopped down? We recognise that they're safe, they're able to self-regulate, then that's what the regular easy to chew is about. And there's a lovely thank you here from John. So hi, Julie and Troy. First of all, thank you both for running the webinars. They've been great. I think it would be good to have some catch-up webinars to share information as there are products currently in test production. Wonderful. That's terrific. Do you know, it may even be the sort of thing where we could host a webinar where can check what the screen sharing's like if people want to show some of their products, and we can talk through what they're actually like there as well.
And that might be a good idea. There might be also jurisdictions that have developed stuff for implementation. Now, at the national conference recently, my counterpart Denise Cruikshank did a presentation on what Queensland Health are doing about the implementation of IDDSI. So there's a lot of resources that I think she shared at that presentation, and we have in-house resources that we've developed to supplement the IDDSI resources. My understanding at this point in time, unless it's changed, is we're not doing any change to food at this point in time, but the drinks we are. So I'm more than happy to share some of that stuff with you if we do perhaps a webinar in early in the new year, might be February or something like that.
Yeah, actually also through, so Denise has kindly offered through the IDDSI, Australian IDDSI Steering Committee, we've got some webinars that are coming up over the end of November and early December, and on the 20th of November she will be presenting what she presented to the IHHC conference about the transition so the different processes that Queensland Health has gone through. So that, yeah, if you need more information about that, that was in the October Australian IDDSI newsletter. We've got another question there. Would there be consideration to removing the word soft altogether from regular? A singular item may cause difficulty in the transition. So I'm with regular, I'm not sure, I'm slightly confused with the question actually. So when we move across to IDDSI, there'll be regular, regular easy to chew, and then soft and bite-sized. So the word soft itself won't be associated with regular at all using the IDDSI framework. Please let me know though if I haven't understood that question correctly.
Hello, you there, Julie?
Yes.
Oh, sorry, it just went sort of quiet there for a moment. So where John is saying before, John Patterson is saying it may be good to have some catch-up webinars to share information as there are products currently in test production. I don't understand what that products in test production mean. Is that products from companies or is that resources? John, do you just want to unmute if you're still online and just clarify that?
Yeah, hi Troy, how you going? Yeah, look, it's products already being tested. So there's a couple of companies out there testing products at the moment, based on IDDSI and everything else that they've got a hold of at the moment. And some of those products should be available in the new year, I would think. So I think it's just good that this information will get out there and they'll be able to share that information. So some of these products are, obviously we've got some formed down here in Victoria, but there's some other products that aren't formed and will be able to be formed on site, which will give some cost advantages, put it that way. And they're doing soups and smoothies and other things like that as well.
So would that be potentially, would you be thinking that it could be us that present that, or asking those companies to come along and show some stuff that they might have that may be able to help us?
Yeah, I think the companies come along in conjunction with you guys and actually present it to the group or whoever wants to be involved. And on a webinar, it makes it easier for a lot more people to be involved, put it that way. So, yeah.
Definitely. Well, that might be something that we can look at down the track, because, you know, if there are companies that are out there. So what we might do is we might, and I'm just thinking off the cuff now, but we might just keep everybody in the loop, and then it would have to be February, because December I'm unavailable, and then January is like just the silly season anyway. No one comes back till February basically. So it might just be that we perhaps do something in February and we keep people in the loop, and then from there, if they have something that they've been working in their workplace with, and like if you have you using something that can help, and it's about sharing information, or you know, Wendy at the RA might have something that she may be able to show other people, or the people from Western Australia might have something that's a good idea.
Yeah, I think it's just a good sharing forum actually, so it helps everyone to get up to speed, and then it gives everyone an opportunity to provide the proper, the right food and good food to those that are disadvantaged. So
Excellent, thank you so much. That's really good.
There was just a little qualifier that was added here, so thank you there about the question. So I'll just repeat the question and then the qualifier there. So would there be consideration to removing the word soft altogether from regular? The qualifier there was that I'd stated that soft under regular was those without prescribed size. Okay, so thank you, I understand that context now. So regular means it could be any texture at all, including soft, but not that you would call it regular soft, or that you would call it regular puree, or that you call it regular anything else. Just to know that regular, if the person is on a regular diet, it could just about have anything on it. That's the intention there. So no, I would never, it should never be called a regular soft. It would only ever be called regular. And if you were looking for that tender food that is not bite-sized, you'd be looking for regular, easy to chew.
So what we might do, by the seams of it, it looks like there is still some interest in some stuff to do early next year. Perhaps we might be able to run a couple of sessions over a couple of months, perhaps talking about an implementation plan, or what we're thinking about doing that for the first one. And then perhaps the next one, if we liaise with facilities or areas that we know are doing some work, and this was brought up by John Patterson, that if you get then in contact with us, and we'll send out information, and if you want to share some ideas of what you've been doing in your organisation and your workplace to help with implementation of IDDSI, that might be a forum for you to share. That would be March, and then there's still only really a month before the implementation then of IDDSI. So then we may be able to run something in February, March and April, if we are up for that, or I'll need to have a talk to Julie offline to see if she actually has time to be able to do that. So even if she needs to be involved, is it something that we can do? So thank you. If you do have any questions, always remember that you can subscribe to the IDDSI newsletter.
Dear.
Julie's email is available. My email is available as well, and I'm more than happy for you to get in touch with us. So there's nothing else. Thank you for your time. Thank you for your interest, and we'll be in touch. But if everybody's on board and of interest, we might do something in mid-February, mid-March, and then mid-April then.
Sounds good.